Snoring, harmless noise or health warning.
Snoring is common and often considered just an annoyance. However, frequent or loud snoring can sometimes signal a more serious sleep disorder. Understanding the difference between ordinary snoring and a potential health issue is essential for protecting your well-being. Let's explore why you snore and when it might be time to take action.
What causes snoring?
Snoring happens when air flows past relaxed tissues in your throat, causing them to vibrate as you breathe. Factors like nasal congestion, being overweight, alcohol consumption, or sleeping on your back can increase snoring. For most people, occasional snoring is not a problem, but persistent, loud snoring could point to underlying health concerns.
When is snoring a red flag?
If your snoring is loud, frequent, or accompanied by gasping, choking, or pauses in breathing, it may indicate a condition called obstructive sleep apnea. Sleep apnea disrupts your breathing during sleep and can lead to daytime fatigue, headaches, irritability, and increased risk of heart disease or high blood pressure.
What should you do if you're worried?
If you or your partner notice ongoing loud snoring or other signs of disordered breathing at night, it's important to talk to a healthcare professional. They may suggest a sleep study to diagnose possible sleep apnea or other disorders. Early detection can help prevent serious health complications and improve your quality of life.
Healthy sleep habits for better nights.
To reduce snoring, maintain a healthy weight, avoid alcohol before bed, address nasal allergies, and try sleeping on your side. These habits not only quiet snoring for some people, but also promote overall sleep quality. Always seek professional advice if you suspect your snoring is linked to a sleep disorder.